Republicans in the Senate released their own version of the health care bill after the one that passed in the House. It's caused a lot of discussion and a lot of consternation with many people. This morning, Randy Wasesche is in, looking at some of the pros and cons of the Senate measure, and this is different from the House measure that passed.
It is not much. It's really not much different than Obamacare. It just tweaks. It's really changes around the edges.
And that's one of the problems a lot of Republicans have with this bill. And we're going to try and take the politics out of this and just look at the numbers.
That's all we do. Go into it, dissect the bill, and look at the pros and cons.
And you're saying both Obamacare and whatever this new measure turns out to be, both have big problems.
Well, they don't address the root cause of the problem. Healthcare is too expensive. And it's not an insurance issue, although this attempts to solve some of the insurance issues. It's a cost issue, and none of them have addressed that.
Well, let's look at the pros on this one.
Okay. Pros, particularly if you're in the wealthy end, it eliminates the 3.8% surcharge on tax on investment income.
And this is for people who have an adjusted gross income of over $200,000 or a couple over $250,000.
That's correct. So it's only on the high end, but it eliminates it.
All right, and the expanded avenues to avoid taxes?
They've increased the health savings account deductibility, very much so, because you'll use it. Now it's up to $5,000 per person.
And then the third one?
Third one is it eliminates the individual mandates. Now, this is going to be on a pro and a con. It depends upon if you like the individual mandates or not. In essence, it says there's no penalty for not having insurance.
And people do like that, although it does not make people get insurance, and that's one of the problems, because you need everybody insured.
Exactly. We're going to talk about that on the con end also.
Right, and then the final one?
What it does is it fixes the state issues with Medicaid as to coverage, and it makes coverage universal.
Now let's get into the cons, and there's some big ones.
Yes. First cons we have there is same thing, tax cuts on the wealthy.
And that's a pro and a con, because the tax cuts come at the expense of Medicaid.
Absolutely, and that's what's coming up. Massive tax cuts to Medicaid. Huge. It's estimated to be larger than the House bill, which was $834 billion. And it also eliminates the mandate that everybody in the states get coverage as they have it right now.
And that's what was supposed to make the plan work, is everybody had coverage.
Correct. And huge for Louisiana. We get a lot of the Medicaid coverage to support it.
Let's go over the last four pretty quickly.
Cuts Medicare subsidies, which the percentage that you were going to get for the Medicare subsidies went from 70% down to 58%. It went from 400% of poverty level down to 350. It repeals the cost sharing reduction program that helped on the co-insurance and the deductible. It allows states to eliminate essential coverage. So what you have as an individual state, currently, you don't necessarily will have under the new plan.
Yeah, so we're running out of time, but basically the winners and the losers in this. The winners are?
I don't know.
People in a high income bracket, I guess?
I guess a little bit.
And the losers would be people on Medicaid.
Yes. And the big one that I did got to put in, the elimination of the mandate so that you don't have to have coverage. Suggests that if you don't need it, you're not going to buy it because there's no penalty not to have it. Currently, there's a pretty significant penalty not having the coverage.
All right, but right now it doesn't seem like they have the votes, so you don't know what's going to happen on this.
I don't. We'll get something, and we'll likely get something over the next month, and it'll be fairly close to what came out, but it won't be good for the public.
All right, Randy, thank you very much. Dave?
Well, that's not good news.